I have a very unique clinical pathway. Early in my career, I felt that geriatrics was a new passion of mine, and it really didn't exist in orthopedics. We have a specialty in pediatric orthopedics, but we don't have a geriatric specialty. And I think the geriatric patients are actually incredibly unique. Just like when you're a younger patient and your parents are making decisions, if you're an older patient, you often have other family members, sometimes your own kids, helping make those care decisions. And it really is a unique process that is beside what we normally assume in orthopedics. And I think even in our own field, we don't recognize that many of our patients actually are geriatric. The average age of an orthopedic patient is usually around 60. I think there's a misconception that we're treating people who are in their 30s to 50s, but truthfully, the demographic is a much older population than we might normally think about. And that really provides some unique challenges. Often people have what we call comorbidities or other diagnoses that play a role. For example, diabetes. Diabetes affects the whole body, but in particular, it affects how bones heal, it affects how wounds heal, and it's very important that we're managing all aspects of those care continuums, not just the broken bone itself. And so geriatrics lends itself to understanding that. And the other unique piece about geriatrics that I do is this idea of transition of care. When you come into the hospital, you often are in a very focused lens. You have a lot of people taking care of you, but we don't really understand the environment that you came from or the environment you're going back to. If you had a break or a break of your bone when you were at your own house, how did you fall? What were the reasons? What led to that in your house? Do you need special grab bars or modifications within your home to keep you from having that again? One of the unique things that we're doing at Ohio State is we're partnering on both ends of the spectrum. We collaborate very closely with local paramedics about understanding the view of the home and know what we're sending the patient back to and why the event occurred. And then the other spectrum, many of our geriatric patients need to go to a skilled nursing facility or a rehab facility for a temporary time period to get better recovery. And so we partner with our local skilled nursing facilities to make sure that we can really aid with that transition. I think it's on the horizon, and I'm really excited about that. And that's a lot of my research work is how do we give the best transitions of care for all of our patients across the aging spectrum.